Good day everyone! Welcome to the CSA Certified Skin Authority. I'm Dr. Contessa, your certified aesthetic physician here at the CSA Medical Aesthetics. In today's episode, we'll talk about a very important topic and a very common skin condition we encounter in our clinic, the so-called acne marks or acne scars. So we have with us Mr. Mark Marquez.
Hi!
Yan. Parang yung topic is like acne mark and we have Mark. Okay, right? So it rhymes. Okay, so Mark here is how young?
22 years old.
22, very young
no?
po. So we know that acne problem starts from teenage years.
Yes.
And then it could progress at the age of like 20s.
Yes.
There's about 80% that at the age of 23, 24, 25, it would start to go down or decrease.
Yes.
So 80% of those who had acne problems at an early age, mga teenage years, 80% of them, it will just stop at mid-20s. But there's a 20% that they retain it. Okay,
Yes.
so I think you are in that 80%. Kasi you're 22,
22.
so nare-reduce na yung mga acne or pimples. Although right now, I can still see mga blackheads, whiteheads, and then also on this part, meron siyang isang inflamed acne, inflamed pimple. Yan. I think it's because of the lifestyle. Yan. The
That's one
others,
factor.
lifestyle because of stress, lack of sleep, overwork, over-fatigue, anxiety. Ayan. That's a common one. And actually, among men, because of their androgen hormones, they are the ones who have the percentage of acne condition na I could say nasa moderate to severe because of the androgen hormones. But the good thing with Mark, he did not suffer from those types of moderate to severe acne conditions. Kasi mild acne condition, mostly comedones and the non-inflamed pimples. So minimal lang yung merong inflamed acne si Mark, right? So let's ask Mark, what do you think are the triggering factors for your case na nagkaroon ng acne?
Well, for me, it's stress and also sleeping late po.
Yun, sleeping
Yes po,
late.
sleeping late. It became a really bad habit of mine.
Yun. I think a lot of young ones right now, because of the generation, computer generation, the
Yes po,
technology,
actually.
I think they stay late. They're on their, like ano ba yan,
Mga
Facebook
cellphones.
or merong ka-chat. Yun. So those are the things right now. Actually, genetics, it can play a role also. So in our family, if we have some like parents na merong acne history, then that's one factor. Aside from the lifestyle, or it's not only acquired, but it can also be genetics then. Okay? And for women naman, the use of cosmetic products. Okay? For ladies also, the hormonal cycle, that's another thing. So, for Mark, it's the lifestyle. Okay, so, actually, the main concern right now are the pimple marks, the remnants, the souvenir.
Yes.
Souvenir nung mga naging pimple dati. So, the good thing, we only have a single inflamed acne here. Later on, we will be giving treatment for that. And minimal comedones, yung mga open and closed comedones, we'll have a treatment for that. So, right now, we have a newer machine that will target those pimple marks. So, it's a non-surgical type of procedure, and I could say minimally invasive or very, very minimally invasive. It's not really the ones with those too much of long needles, okay? Kasi the condition is not that severe. I could say minimal to mild. Okay? So, yung kay Mark kasi, we wanted sana po clear of all those souvenirs from pimple. And also, we wanted the acne to stop already. We wanted to, as much as possible, have a pimple-free skin or acne-free skin and a scar-free skin. And we want the texture of the skin to totally improve, and also the pores we wanted to minimize, and we wanted to have so-called oil-free skin yung hindi oily skin, hindi na acne-prone skin, okay? And also, we wanted to balance the complexion, yung well-toned skin, kasi some people have concerns of yung aside from the acne marks na sunken scars or pitted scars, the others, ang concern nila are pimple blemishes, kasi I could still see also some pigmentations from the acne, right? So, yung mga acne blemishes. So, we'll treat all of those. Okay, Mark? So, I'm excited on the procedure that we will do to you.
Me too.
So, don't worry, it's not really a very aggressive one. It's, I could say, for me, it's painless, okay? So, ating ipakita ang actual procedure sa pagbabalik ng CSA Certified Skin Authority. Back mga ka-CSA, so we're still with Mark here, okay? So the actual treatment that we will be doing will be the so-called RF fractionated micro needling, okay? So this is another aesthetic device. It's new here at CSA, and it's targeting the reticular dermis. That's the one we need to reach to be able to induce collagenesis and the formation of new tissue matrix or connective tissue matrix. So we have our machine here. This is the RF fractional micro needling. It's a brand called Ensemble. Okay, so the screen there is a touch screen. So it has some of those parameters there. So what will be the power, and then the duration, the time, and also some interval, and like if it's a repeat treatment or not. Okay, and the face there is telling us how much of the strength and also the depth of the needle that we will be using. So, meron siyang part na forehead, under the eye, the mid-face or cheek area, corner of the mouth or the jowl area, the chin, and also under the chin, the neck part. So, pwede rin siya sa neck area, face and neck area. For Mark, we wanted to target the entire face because forehead area, we also have pimple blemishes here, temple region, mid-face, okay, the cheek area, nasolabial area, lower face, so the mandibular area, and the chin part. Okay, so if you're gonna assess the so-called like split face assessment, sometimes we check which area has more acne scars or acne marks. And looking at Mark, I think there are more of the bigger ones here, and on this side, it's more of like a pinpoint and more of like blemishes. Okay? Before we start, Mark, do you have any questions? Any questions for the treatment? Have you heard something about our procedure, the RF fractional micro
I heard
needling?
that it reduces wrinkles also.
Yes. That's a very good input. Yan, nag-i-input na si Mark. So, it can also treat wrinkles, lines, fine lines, and even sagginess. So it has an anti-aging benefit because it will reach the dermis where you will synthesize new collagen fibers. So it's going to tap the dermal fibroblasts. So you will make the newer collagen and newer elastin. So aside from treating acne marks, acne scars, acne blemishes, it's also anti-aging. It's gonna treat fine lines and wrinkles. Actually, I did had a patient before, 19-year-old male, who came to me with a complaint of forehead lines already. 19-year-old male who already had wrinkles on the forehead. So that's an early aging, right? So this is like, wow, it's like it has bonuses, it has extra benefits. Okay, kasi aging starts daw right now 25. Before 35, now 25. Baka next time 20 and then 15. Okay, so you're in 22.
Yes.
Okay. Pero looking at Mark forehead region, ooh, I can see minimal lines already. Oh, talagang ang batang to masipag. Okay, because really aging right now is accelerated by our lifestyle. If we are really so stressful, we lack sleep, and then we're overworked, over fatigued, most of our cells are also overworked, then that will lead to premature or accelerated aging. Okay, so then the moment you notice already these signs, then we have to do something to combat this and prevent it. Okay, so the earlier you start, the better also. And this is part of our skin care, the health of our skin. Okay? And of course, we wanted to make our skin clear also. This will boost our confidence. So
Yes.
most of the patients that I worked with, really it boosted their self-esteem, self-confidence. They were saying, if you look good, you feel good. You really
That's right.
feel great. Okay, and the more you become productive, and then like when you face other people, and then wow, we were saying like you are looking great, and it's like boosting ourselves too. Tama, Mark?
Tama po.
Yeah. So right now, what we're gonna do is we'll be using this machine. A while ago, we did cleansing of the face, and after we cleansed the face, we applied topical lidocaine cream. We left it for about 45 minutes. And then the position that we need is that Mark should be in a like flat bed position. So lying position po tayo. So this is our motorized bed. It can lower the head part. Okay, so everything right now is push button na po. So yung bed natin, push button lang, ilo-lower na po niya. So the target of our machine, as I've mentioned, Mark, is the reticular dermis. So it has some multi-depths too, meaning to say certain skin depths that the tip of the machine can reach into. Like we have layers of our skin, right? Epidermis, dermis, subcutaneous fat, or the hypodermis or subdermis, and below that we have some muscular, fibromuscular layer, or even the fascia also. Okay, so I have here the Ensemble RF microneedling. So the handle is here. Okay. The handle is here, and then it has tips that contains your microneedles actually. So meron siyang mga tiny needles. Okay, certain tiny needles, and this is like a square type tip. And the tips are usually the insulated type of tips. And the tips of the needles, they will emit the laser, the radio frequency laser. Once they reach the reticular dermis, they will induce a so-called thermal coagulation. And those are called TCPs, or thermal coagulation points. And they will stimulate the synthesis of new collagen fibers, new elastin fibers, and the new connective tissue matrix to improve those scarring or those sunken marks, to create new tissue matrix and then close those sunken scars. Make sense, Mark?
Yes, ma'am.
Nakuha po?
Yes
Yeah.
po.
So, some of our lecture already here. So, the needles have certain depths or multi-depths. Okay, it starts from 0.25 millimeter to about 4.5 millimeter. Okay, so if we want to reach our dermis layer, the certain length, actually you should go like 2 millimeters. So for Mark, it's our first treatment, first session. We can start with a 1.0 millimeter. Okay, and it still will vary depending on the depth also of the scars and the type of the scars. So we doctors will have to diagnose the specific scar condition. So for now, I'm starting with the 1.0 millimeter depth. And then this is a very versatile machine also, okay? And then I can work on with the chin part, the skin on the chin part first. So this machine has the radio frequency technology also. That's why it has the benefit of anti-aging. Those with saggy skin or wrinkling skin, they will also benefit from this one. So not only the acne marks or acne scarring, but also the aging skin. So after this procedure, it's normal to see some redness on the skin. and a little bit of skin elevation or like skin edema, a minimal one, but that will go away in a little while. Because we also combine this with our Helix Machine or our cryotherapy machine. So after this, we ask our patient to avoid sun exposure, stay indoors at first, and do ice compress on the face. And when you go out, like there's a need to go out, just apply your topical sunscreen. Okay. So we really have to target the acne scar area, and we expect to see some pinpoint bleed because we have microneedles here. So it's also ideal to work on the jawline area because I can see pimple marks on the jawline also. Okay. So they were saying no pain,
No
gain.
gain.
More pain,
More gain.
more gain. Okay, so now I'll proceed to the left side. Okay, I'll start on the mental region first here. So I think this is a tolerable treatment for marks.
Yes, ma'am.
Yeah. Now, this one has a very good advantage over the old CO2 fractional laser we were doing before. For individuals who are prone to have post-inflammatory hyperpigmentation, that's the effect you get from CO2 fractional laser. So with our RF microneedling, we minimize the effect of post-inflammatory hyperpigmentation. So if our patient is prone to having blemishes or pigments, we rather prefer to do this procedure for them. Okay. And the good thing with this is, as we have mentioned, it has added benefits of anti-aging. Okay. So I'm targeting lower face and mid face. So once we have already passed certain areas of the face, we have created already so-called microchannels. And then we can repeat the procedure for this kind of treatment modality. It can be repeated every 3 to 4 weeks. Because we give time for the skin healing, skin recovery. Some of our patients, we combine this also with the so-called PRP or the platelet-rich plasma. The plasma containing the platelets help in the faster skin regeneration and skin healing. Because our platelets, inside them, they contain granules, and those granules also contain kinda like stem cell peptides or growth factors. Okay. So there's already redness and also noticeable skin elevation, which is a normal effect from this kind of treatment. So I'll be moving to the forehead region. I can decrease the depth. So actually I started with 1.0 and then 0.75. I can make it 0.5 depth. Okay, because the skin here compared to the other parts of the face, of course this one thinner. Okay. So we have thinner tissues here, and it's bony, so we have to also be careful on the forehead part. So I'll do middle first, so medyo we have to kind of try to tolerate as much as possible. If you see your patient having this reaction, you can still lower the depth of the tip. Okay? So Mark, okay lang. Yan. I made it 0.25. Okay?
It tickles though.
It tickles. Okay. That's a good sensation. Ticklish po si Sir Mark. Okay. So, basically, we do like number of shots. We can already see the counts, the number of shots that were delivered. So, how many shots were delivered? So, okay, we are now on the 112 shots. Okay. So, in one treatment, some cases we start with 100 shots, 200 shots, 300 shots, and if we include the neck, it could be 400 to 500 shots. So you can also do this in our neck area or the so-called décolleté or the upper chest area, those people whose concern is the aging on the upper chest area. So like people who love to wear like blouse that are lowered or like plunging necklines, then if they want to show the skin very rejuvenated, then they can do this kinds of treatment. This kind of aesthetic device can also be beneficial for them. Okay ka pa, Mark?
Yes, ma'am.
So Mark is relaxed. Okay, so for our patients, when we do procedures like this, we give them list of home care instructions. Kasi most of the patients are asking, Doc, ano pong bawal after? So we give a list of instructions or reminders and what to avoid, what food to eat and not to eat. And then we give them like a schedule for our follow-up. Okay. So we have an active acne there. Later on, we'll just give an anti-inflammatory injection for that one. Okay. I have to avoid it. Okay. So we've done forehead and temple region. Now we can also proceed to the nose region. So nasal area, some people have these open pores on the nasal tip, right? So they also wanted to improve the skin texture on that part. Still okay?
Yes, ma'am.
So we're nearing the final procedure. So the tip that we use is individualized. So it is a sterile tip, and ideally this is a single-use tip only because it has needles. So it's very important that doctors are observing a so-called aseptic procedures. Okay? So remember, this is a procedure that has needles. Okay? So we are making use of sterile, single-use needles. Okay? So we have done a total of 164 shots already. So right now, we can already proceed with a Helix machine. A machine that will give a faster relief, like the reduction of the redness of the skin, as well as a so-called cutaneous edema, a very temporary edema on the skin. So ating pang ipapakita ang Helix treatment ni Mark sa pagbabalik ng CSA Certified Skin Authority.